Hi, I'm Dr. George Merriman, Freedom from Obesity. I want to talk to you about your life after weight loss surgery. Okay, I've had surgery, now what? And honestly, to me, this is the most critical component of what you as a patient and what I as your surgeon and physician do, is helping you establish what your world, what your lifestyle, what your environment, what behaviors and practices you're going to need to solidify one day at a time for the rest of your life. Again, remember, you suffer with a chronic, recurrent, relapsing, incurable disease that is genetically embedded in your hardwiring, and none of that is being changed with the act of surgery. But we can have profoundly positive influences on what kind of results you get by the things we choose to do after you get operated on. And there's four kind of large categories that I want you to think in terms of. The first one would be kind of your environment, not just your behaviors, but your environment. We have long thought about our genetics as rigid and fixed and unchanging. Our hardwiring is kind of set. And we now have come to learn that no, our hardwiring, if you will, our programming can easily be impacted by the environments that we live in, by the decisions that we make, by the behaviors that we choose. And I'll just give you one example, and obviously we will talk more in detail about this as we interact over the rest of your life. But for example, one of the most effective things an individual can do in this 24/7, 365 kind of world that we know has a significant negative impact on your ability to control your disease is to get a good night's sleep. And studies have shown people who can get at least 7 hours of effective sleep at night are doing profound things to minimize their obesity genetics, whereas people who get less than 6 hours of effective sleep at night significantly enhance the negative effects of their obesity genetics. The second category, we could label prescription drugs or drugs, but I would even say chemicals. But we now know there are many prescription drugs. For example, all of the serotonin active antidepressants on the market, like Lexapro, Celexa, have a negative impact on your surgery's ability to control your disease. So either getting from a much worse acting drug to a less worse acting drug, or even getting off the drugs completely. There are many diabetes medicines also that have this effect, and start going through those lists of things to see if we can modify them to improve our outcome. I include chemicals, which is why I encourage people, whatever word you want to use, organic or the following, but the chemicals in the food chain, to eat food sources that aren't filled with hormones and aren't filled with antibiotics, I think is a profoundly positive step individuals can take. The third area is menu. We have classically thought of the menu you eat after a weight loss surgery as kind of a one-size-fits-all. And now we understand that it's not, and that each individual is going to have to ascertain, kind of through trial and error with our guidance, what's the optimum menu for them. And then finally, exercise. Again, it's kind of like food and the menu. One size does not fit all. There are certain exercises which profoundly positively impact one individual patient, but would significantly negatively impact another. And with our guidance through trial and error, but also with insight and understanding, we're going to find what is the optimum exercise plan for you. These are just the four large categories. There are many more. And this is why over the rest of your life with surgery, we work to figure out what these environmental factors are that we can work with, eliminate, amplify, whatever it is, to help you not only achieve but maintain lifelong results with your weight loss surgery.